develops these new solutions from the ground up. So have you got your clicker there?
No.
It's Mark run off with a clicker.
Sorry, I'll put it on the table.
There it is.
Thanks. Right, good morning everybody. Hello to everybody I haven't had a chance to say hello to so far. Can you all hear my voice? I don't tend to mumble, in fact if anything I talk too much. Everyone hear me at the back? Yeah, okay. First of all I want to say thank you to David, thank you to Julia, thank you to Nigel, thank you to Mark, wherever you've gone, back there, which leads very nicely into hopefully presenting to you our solution, but more importantly, how by collaborating we can learn and explore the best use of technology to achieve the best outcomes. So here is our vision: to provide better quality care at the same cost, so that people can live in their own home for longer, more safely and with greater independence. What we mean by at the same cost is whatever you invest in technology now saves costs elsewhere, and it neutralizes that cost. May I start by telling you a little bit about Secure Meters' background before I go on to discuss our service development and assistive technology. It will hopefully help you to realize the scale of our company and that we are in this for the long haul. So bear with me. Secure Meters as a company have been around since 1987, when we manufactured our very first electric meter. Since then, we have been leaders in innovation for metering, controls, monitoring of consumption use, and smart meter technology in the areas of electrical meters, gas meters, and water pumps. We now have 4 manufacturing plants, 3 in India, 1 in the UK. Most importantly, we handle the security for all data collection and provide this as a service to energy companies in over 50 countries. We collect data from 6.5 million meters every single day and supply to 37 energy companies by 8 o'clock the next day. We have supplied over 35 million products worldwide, including smart meters and smart home solutions, and have run our own energy supply company to over 670,000 customers. All I really want to tell you is that we are used to providing robust, proven technology on a large scale. It's what we do. We are successful, we're proud of that, and we're here to stay. So, I hope that you've seen from the previous slide that we have all the building blocks in place and our products are already in over 6 million homes. Okay. Technology-enabled care has come a long way during our lifetimes, since the first introduction of the analog pendant alarm in the 1970s. I'm going to tell you a little story. 5 years ago, our group chief executive visited a home in Sweden and saw for the first time how a smart home could enable an older adult, and I'm going to call her Alice, to live better with independence, control of her environment, with greater mental health and family peace of mind. That got him thinking. Our company already provides smart software solutions into people's homes. How can we improve on the independent living services that are available now? Could we make a difference to that market? And how could we add value to that market? And that was it. It was simple as that. The seed was sown for the development of beanbag care services. I have worked as an occupational therapist specializing in older adult care for the majority of my professional career. And in my experience, older adults adapt extremely easily and quickly, as long as they understand what you're giving them, have a clear explanation, and get given the right support. If you ask an older adult what they want in terms of care provision, they will tell you a carer who arrives on time, completes what they're meant to complete, treats them with respect and dignity, spends time to listen to them, listen to what their needs are, and respond to that need. But, even more importantly, help them to achieve their personalised, individualised rehabilitation goals. In other words, empower them, not just treat them. Tech should not and must not replace human interaction. We've talked about that. So what is the challenge you, us, we must face in order to help older adults benefit from technology-enabled care? How to identify a quick, easy and efficient technological solution to keep people safe and independent at home, avoiding the need for hospital admission, unnecessary hospital admission, or more complex social care, increasing the impact of technology-enabled care, tech services, and embedding tech as the first line of response to social care needs, taking into account health and social care models focused on early intervention and prevention. How technology-enabled care services can be attractive to older residents so that they are taken up and used for their maximum benefit with greater efficiency and, of course, demonstrable cost savings to statutory services and, of course, all care provision. You will also need to be confident that our service delivery is future-proofed, given the current rate of technological development. Let's look at some of the ways that councils are addressing multiple service needs. There's a conflict in the provision of multiple solutions. Councils may provide scheduling and monitoring systems such as CM2000 for care providers. They may provide their own to evidence commissioned care delivery. Technology that is designed to support an older adult in their home often comprises multiple solutions to address different problems. Care providers need to demonstrate fundamental standards of care to the CQC, we know that. Assessing on whether they are safe, effective, caring, responsive to people's needs, and that they're well led. Well, the vast majority of care providers send out 6 monthly questionnaires to gather feedback for service users to fill in their own homes with a very poor response rate. And it doesn't really give great confidence to the service user that their needs are actually truly being listened to and responded to. These requirements are all considered individually. Our approach will be to turn this on its head. There's Alice in the middle. We are calling our assisted living service beanbag care. Think of the analogy of comfort, support, and youthfulness, and the ability of our services to mould to the individual's needs. Putting Alice at the centre, the beanbag care system we deploy enables us to combine all of the above: scheduling, monitoring, quality of care assurance, and technology into a common platform, and to do so much more, and to do so much more as technology improves. All the technology, you probably can't see that from there, but when you get a chance to look later, please do have a look at the board at the back there. Heating controls, multi-sensors, a tablet for communication, and mobile phone apps will support Alice to remain independent at home. The 4 key end-to-end assisted living services we are developing are assisted comfort. This monitors environmental changes, for example, temperature, humidity, carbon monoxide emissions, to keep service users safe and healthy. Reduces the risk of health-related falls, for example. Plays a significant role in preventing the exacerbation of respiratory conditions such as chronic obstructive pulmonary disease, to name just one. The service also, with the service user's permission, allows families to remotely monitor their environment and to intervene should these levels become unsafe, bringing families closer. getting the community involved. Quality Care Assured is our second service. This is a service that includes scheduling and monitoring of carers, as well as, for the first time, facilitates real-time feedback using the tablet we install and the mobile phone app for responders on quality of care received from both the service user and their family or their friends. Our service development will add You Will Never Walk Alone. This service provides multi-sensor technology to recognize a fall with or without a wearable and alert for help. Also, should a person wander, the system recognizes they've left the property and alerts for support to locate as required. Finally, with the addition of Inform the Carer, our fourth service, we will use multi-sensors to recognize changes in daily routines that could indicate a health need, for example, more frequent visits to the toilet, or a significant change in sleep patterns, and alert responders to check on their well-being. We then, of course, have you and the family and friends, the stakeholders. Family members, friends, carers, local authority, extra sheltered or independent living schemes, retirement villages, GPs, social services, the National Health Service, some of whom will need to make a financial investment. All will benefit, but who will pay? A major advantage of our services is that they're designed to be future-proofed. All our services can be upgraded over the air, in other words, remotely, as technology improves. Let's break this down just a little bit. What are the benefits? Quality Care Assured. Real-time evidence on care quality. Commissioners and care managers can target where improvements in care provision needs to be focused, such as staff training, such as timeliness, such as response to feedback. The quality of care will improve. It has to. If a service user is not happy today, her issue can be dealt with immediately before it develops into something more serious. Reducing the number of formal complaints and associated administrative costs. Fewer quality care assurance visits, typically done by a care manager, observation visits, and automated report generation for business reporting and care quality commission audits results in less administration, less cost. Greater peace of mind for service users and their family on carer timeliness, task completion, communication and complaints resolution will deliver administrative benefits. Integrating scheduling, monitoring and care quality. So by adding evidence for care quality to a scheduling and monitoring system, we're able to provide a more complete picture of care delivery more cost effectively. You Will Never Walk Alone. Non-wearable fall detection. Our service addresses the weaknesses in current pendant alarm provision. Pendant alarms depend on either a person falling at a certain speed or an assumption that they're willing to press the button. Some don't want to press the button. They don't want to alert for help. Or they're not able to press a button because they're unconscious when they've fallen over. Our technology recognizes a fall without a wearable and alerts for help automatically. Early intervention reduces ambulance call-outs and unnecessary hospital admission. Inform the carer. Early alert of behavioural change. By monitoring a person's activities of daily living, our technology can identify a change in behaviour that might indicate a health need, a change in sleep pattern, for example, identifying that a person has not made it to bed or has stayed in bed for an extended period of time. With the service user's permission, a relative or friend can be alerted to check that they're okay. Early intervention reduces cost and improves well-being and can free up health professional time where it's better needed. Fourthly, assisted comfort. Healthy, safe and comfortable environment. What does that mean? A healthy, safe and comfortable environment will help a service user remain in their home longer. A well-monitored and controlled home environment prevents an exacerbation of a pre-existing medical condition and is a positive contribution to physical and mental health. Become unwell, go into hospital, guess what? You become miserable. You're not happy. It affects your mental health. This could reduce the number of GP visits and prevent early admission into care homes due to poor home health. And the real benefits to Alice. Confidence in her own independence. Able to remain at home confident in her own abilities with the support of the beanbag care system. Better control over their quality of care. Alice has better control. Having the ability to provide anonymous feedback anytime and be able to resolve issues quickly via her tablet. Feeling safe at home and comfortable, knowing that the environmental controls will alert if any danger, enables Alice to feel safe. Better informed and listened to. Alice knows who's visiting, when and what tasks they're going to complete. She's informed of any change in carers in real time. Improved communication with care provider helps Alice to feel her needs are being met. Immediate and relevant feedback helps Alice feel listened to with fast complaint resolution. Help can be received quickly. Family or friends are alerted and can respond quickly. Any escalated alert to a response centre results in fast emergency response. Greater physical and mental health, I've mentioned that already. Maintaining a healthy environment will help Alice remain physically and mentally healthy. Alice can relax, knowing that her family or friends will be alerted if she gets in any difficulty or shows any adverse changes in behaviour. Issues can be addressed before they become serious. Improved social inclusion, that's a big one, isn't it? How can we help our service user, Alice in the home, become more socially included? She's happier being more easily able to speak to friends and family via the tablet that we install in the home and Skype call facility. And family can contact her anytime. Finally, peace of mind for service user and family that help is available quickly. Alice has peace of mind that she's well supported if required and knows that she will receive help quickly from family and friends, those that she cares about, responders or ultimately a response centre. In summary, let's collaborate, let's work together, let's learn together. Let's develop services together to provide technology-enabled care into the home. Let's support older adults to live independently in their homes longer with a cost-effective solution that reduces hospital admissions, early admissions into care homes, prevents unnecessary ambulance call-outs, brings communities closer, and reduces the enormous burden on our already overstretched statutory services. What system can we use? What bits of our solutions that I just talked about are most relevant? We can send a number of people to you, come and collaborate, come and talk, set up workshops, to scope out a project, run workshop days, look at the system that you're already using, and work out something specific for you. Thank you. So we're now ready for questions.
Yeah, the questions, please.
You've had enough.
Okay, well, if anyone is interested in knowing more about Beanbag, obviously, can the Beanbag people stick their hands up just so we know who they are? There's 3 here, and also there are these cards on the table. So if you did want more information, please fill one of those out. Now it's onto the roundtables, if that's okay. So what we've done is we have divided everybody into here into 3 groups. and they will basically be split into a group that will be based out here, another group at the back, and then one in the reception area in the lounge out there. And what essentially we've done is